This is the Dr. A Explains It All podcast, a podcast about cosmetic procedures, skincare, dermatology, and everything in between. I'm board-certified dermatologist Dr. Arash Akhavan. Let's get started. But first, a quick disclaimer.
Medical disclaimer. The information provided on this podcast is for general information and educational purposes only. It is not intended as medical advice, diagnosis, or treatment, and should not be relied upon as such. Listening to this podcast does not establish a physician-patient relationship between you and the host or any contributors. If you have specific medical concerns or questions, we encourage you consult directly with a licensed healthcare provider or physician in your area. The views expressed in this podcast are solely those of the individuals and do not necessarily represent the views of any affiliated institutions or organizations. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment. Never disregard professional medical advice or delay seeking it because of something you have heard on this podcast.
We're back, episode 3. I don't think we realized how popular this was going to be.
Yeah, our patients like it, and lots of people we don't know, so it's been nice. Yeah, positive reception.
So episode 3, I really want to talk about cellulite. I think that it is something that patients reach out about a ton, and it's something that 95% of women have. I might be off on that stat. You know better than I. But it's something that, almost everybody has, and we get a ton of questions about it. We do have some really great procedures that help to improve it. And I kind of like the way that you sort of break it down. So let's talk about cellulite today.
Yeah, so the stat's probably a little less than 95%, but that is the main thing to know about cellulite is that it is very, very, very common. So, some studies say 70%, some say 90%. I've seen as high as 90%, 95% certainly with possible. But yeah, so it's the norm. That's the most important thing to know about cellulite. It's not like it's a disease state, has nothing to do with health, has nothing to do with even skin health. It's just a normal thing for most adult women. And it can actually start even before you're an adult. It can start in adolescence.
Right. There's a genetic component to it, isn't there?
Yeah, genetics definitely plays a role. Much, much more common in women than men. We have seen it in men very rarely. It's much more common in women, and that kind of gets to your question, what is cellulite? So it's a condition, primarily occurs on the buttock and the back of the thighs. Those are the most common places. You'll see it on the side of the thighs, sometimes on the front of the thighs, but primarily on the buttock, back of the thighs. And it can kind of present in two different ways, either dimples. So picture like the little puckered dimples on a golf ball. So little circles that are pulled in. Or it can look kind of like rippled skin, so just skin that isn't smooth. And they're both conditions that are caused by collagen issues, and they're very different causes. So with the difference between men and women, as far as we understand, is for the attachment of the skin to the underlying muscle. So you have the skin, then you have fat, then you have muscle. You have these collagen bands that are running from the muscle layers to the skin layer, holding everything intact together. Mm-hmm. In men, these collagen bundles go in every direction, haphazard, left, right, diagonal, straight, parallel. In women, they're organized much more neatly in parallel bands. I don't know why. And if those collagen bundles as you age get shortened and condensed and hardened, it'll pull down on the skin, causing dimples. Mm-hmm. And then also if we lose a little bit of collagen, which we all do, and you lose that attachment between the muscle layer and the skin layer, the skin will get rippled. So you'll see it's not smooth. So one other way you can kind of tell them apart is that rippled cellulite, if you pull the skin really tight upwards, like towards your head, it gets smooth. The dimple ones, they don't go away. They're there. And the treatments are different. Which one do you feel like we get asked about the most? I mean, I know we have patients that have both, but
We definitely have both. I would say for a patient, it's hard to discern between rippling and dimpling.
so they just, when they call you, they just say, I have cellulite.
I have cellulite. I would say more often than not, it is more of that laxity, horizontally running cellulite that is bothersome to the point where someone wants to do something about it. But most of the younger patients, I feel like, who reach out about cellulite are dealing with those dimples and are generally great candidates for Avéli, which we'll get into a little bit later. But we definitely get a ton of reach outs about both. And laxity seems to be kind of what you diagnose a lot of the time.
Yeah, that sort of rippling one, I think, gets more common the older you get. That dimpling you can get, when you're 16.
Yeah.
Yeah. And again, just stressing that it's not something that needs to be treated in any way. But it does seem, and studies have also shown this, that the majority of women who have cellulite, if there's an effective treatment for it, would want it. So it does bother people for whatever reason. And it's nice that we're now able to provide really effective treatments for it. It's not like the old days where nothing would work. Now we have amazing things that work. Yeah. And it's interesting, the cellulite treatment ones, and we've discussed this before together, is the patients will literally cry tears of joy in the room. And that's not that common in the cosmetic dermatology world, but with cellulite treatment it is. And you can tell how much it's been bothering the person for a decade, 2 decades. Yeah, and to just see the final results, it's really satisfying from our viewpoint also, just to get to experience that with the patients.
I would say that our cellulite treatments are one of my favorite things that we do in the office, just because of the response and the result that patients get and how happy that they are, and almost unexpectedly better than what they thought that it would be. And the fact that these things last for a while is also amazing.
And some of the treatments, and we can discuss them, the results seem, when you look at the pictures, too good to be true, but they're true. And that's why I think the patients, with every cosmetic procedure, I think every patient comes into any office being like, those results are probably too good to be true. And then when they see that, nope, that's what I got. I'm perfectly smooth now in the area that was bothering me. And they just get so happy. Yeah,
it's a really happy thing. What are your favorite treatments for cellulite? And if we could break down the treatments that are great for the dimpling and the treatments that are great for more of the horizontal laxity and stuff like that. We'll start with dimples, but
yeah, they're very different, again, because the cause is different. So for the dimples, again, that's because the collagen band is constricting. It's pulling from below. It's gotten shortened and hardened, and it's pulling on the skin. So our treatment, the most effective treatment, would eliminate that collagen band that's pulling down and release it, and then the skin would pop back to the surface. Those are really satisfying treatments because our sort of results thus far have been, when you treat it, it's permanent. Our current favorite treatment for that is Avéli, the one you mentioned. I love that device. It's really simple procedure. You can visualize the collagen band that's causing the problem. You can double check, is this the collagen band that's causing the dimple? You eliminate that band and you see the results right there. And they have some minor bruising for a couple of weeks, and they can be on the beach a couple of weeks later in a bathing suit, and they're fine. So it's pretty cool, and the results are amazing, and nobody's dimples have come back. So that's good too.
Yeah.
Before Avéli was out, we used to do a lot of this procedure called Selfina, which was also amazing. Not as sophisticated. Obviously, it's an older device as Avéli, so we don't do it anymore, even though we have the device. It's just kind of sitting there collecting dust. In between those two, an injection came out called Quo, which we did a couple of patients with and had great results. And then just saw physicians in use were just reporting such horrible bruising with it. And then we decided to just not do anymore, not press our luck. We had a couple of amazing results, and I'm glad we stopped, because one thing that then happened was a lot of patients, the bruising was just so bad. They got skin staining from the bruises. And then there's really old devices like Cellulite and stuff like that weren't that effective. I don't think anybody's really doing them anymore.
Yeah.
So that's for dimples. For ripples, it's not as satisfying. So we have some results where it's just spectacular, but we have to do a lot to get there. So probably the most popular device right now is one called M-Tone. It's a device that uses heat, radio frequency, to thicken the collagen layer, build up the collagen layer in the skin. And it uses another technology called acoustic sound waves, which are basically shockwave sound waves going in. They say it improves circulation in the area and things like that. I think it's just basically just pounding down on the fat. It's really the radio frequency that's working on it. The cool thing about the shock waves is they make you feel the radio frequency less, because it's a pretty intense device.
It's almost like a distraction.
Yeah, almost like that. But that's not what it was made for. The two together were shown to work better than either one of them separate. I just don't completely know why.
Yeah.
The problem with M-Tone is the results are great. There's no downtime, all that, but they're just very short-lived. So some patients need to just keep doing it like once a month. Some patients can get away with doing it once every few months, but it's not you do it and you're cured, your cellulite's gone. You just have to keep doing it. A longer lasting thing that's not FDA cleared that we do is there's a filler called Radiesse, and we mix it with saline. So we dilute it. It's called hyperdilute Radiesse. We really dilute it with saline, and then we inject it under the skin. And it doesn't add volume that way, because it's mostly just saline that's being injected. So they look puffy right after the procedure, but that goes away in a few hours. It's just saline. What's left behind is this coating, really finely dispersed everywhere, of this Radiesse. And the Radiesse causes new collagen generation in the patient. It's cool because it lasts a lot longer than the M-Tone. Downside is bruising, and it's very expensive, depending on how much area you're doing.
Right.
But results may last like a year or even 18 months in some patients. And the best results we've had, which, these are sort of really exciting, where we've seen really amazing results for this rippled type of cellulite, is where we combine the two, actually. And there are studies showing that hyperdilute Radiesse followed by radio frequency, it's almost like the radio frequency activates that collagen production pathway and just kind of augments your results. And that's what we found as well. So we'll do the Radiesse together with that, and the combination's been great as well. Just gets so pricey, and it's not permanent. Best case, we're talking 18 months, maybe just a year.
Yeah, so a bit of upkeep needed.
What's that?
So a bit of upkeep needed.
Yes, upkeep needed. Yep.
And just quickly to go back to the Avéli self-venous, when we're talking about that versus Quo, I think it's a really, really cool procedure. So just to kind of break it down a little bit further, the Avéli and the self-venous work very similarly in that it is almost like a it's minimally invasive, which is something that we should definitely mention.
Right. Neither one's non-invasive. You're right.
That it does have a little bit of downtime with it. The Avéli and the self-venous are usually kind of inserted right underneath the skin, a tiny little needle-like device. And it actually cuts that band that you've been talking about that's pulling the skin through the fat into the muscle. And it's really, really great. That is not the same as Quo. And Quo, being an injectable device, was actually meant to dissolve those bands, is how I kind of understand it.
Correct.
So just to kind of further explain
let me see.
the differences.
For those of our listeners watching on YouTube, so this is actually the Avéli device. It's a really fine, little tiny probe that's inserted under the skin. This they probably won't be able to see on camera, but then we push out a little hook, and then that hook catches the
band.
cellulite band. We tug on it to see if it's actually causing the dimple. We eliminate the band with another button. We check to make sure that we can no longer tug and cause the cellulite band, and then we pull it out. And that's as simple as that.
It's amazing.
Yeah.
Yeah, I just wanted to get a little bit deeper into that because it is the coolest device and procedure that we have.
Cool, but so simple.
Yeah.
Yeah.
And it's like such a huge difference for such a tiny little quick in-office procedure that you're awake and chit-chatting through. It's not something you need to be put out for. It's not something you need, your friend to come pick you up from the office with. It is really easy and really comfortable.
Yeah, I mean, it's simply like you just come in, we mark the cellulite dimples we're going after, we numb it with local injections of lidocaine, just like any skin procedure we do. Or like when you go to the dentist's office and you have a cavity, same Novocaine. So that's injected right where we're treating. That's the only part you feel, the little needle from that. Then we do the procedure. You don't feel any of that. Patients are talking, they're watching shows on their phone, they're doing work on their laptop. And then we do have you wear like exercise type compression, so not special surgical garments or anything, just like regular yoga pants and leggings. And you wear that for the first few days to help with the bruising. And you can exercise as soon as you feel comfortable. We've had patients exercise the next day. We've had patients wait like 2-3 days. Nobody takes off work or anything like that.
And actually exercising, I feel like I've heard you say, can help improve the bruising and the discomfort because you're kind of getting blood flow to the area, kind of moving it around. Is there any truth in that?
Yeah, I mean, you may be mixing that up with another thing. I do like that with blood vessel veins, leg veins. No, this is just really, it doesn't help or hurt. It's just whenever you feel comfortable, you can go get to it. Yeah.
And it hasn't been long, according to our patients.
No. Yeah, most patients like a day or two. And it's like I said, the coolest thing about it is how happy patients are after the treatment. It's such a pleasure. The day they come in for their after photos, I love it. I look forward to the Avéli after photo day.
Me too.
And there's this whole thing with every good thing. I feel like sometimes people ruin it. So all about body positivity and, having people just feel comfortable in their own skin and not feeling like they need to do something. Again, cellulite's completely normal, but you'll have like a perversion of the body positivity sort of movement, and you'll have people just confused and saying it's wrong to treat cellulite. You'll hear the same thing about stretch marks. Like, why would you treat cellulite? Why would you treat stretch marks? You can say that about anything. I mean, people are doing it for two reasons. They're doing it for themselves, or maybe they're doing it for society, just because they're societal norms. And it just like brushing your hair, nobody needs to brush their hair. You can all just walk around with messy hair. Right. Certainly nobody needs to color their hair. We could all have white, gray hair. Nobody needs to do get a manicure. Right. You don't need to paint your nails. It's just things people decide to do. And there's some societal norms. People mostly do it for themselves, I think. And it's kind of crazy for people to pick on people who want to do these things. And it even gets to the point of like confusion on things like social media platforms and things like that. Well, they'll censor cellulite treatment because it goes against body positivity values. That's just such confusion and such garbage from these social media companies and just their algorithms, and not picking and choosing what is okay and what's not okay. So Botox okay, treating cellulite not okay. Yeah. Lip filler okay, treating stretch marks for pregnancy not okay. Who decided that? Some algorithmic thing at, Meta. Yeah. So that's unfortunate. And that's kind of going against the whole the idea behind the body positivity movement. Like, you should support people and doing things that make them happy.
Yeah.
And I love providing things that make people confident and happy.
Yeah. I think like a lot of the stuff that we do and the way the office runs in general too is that a lot of the time it feels like we're helping people.
Yeah.
We're not, trying to make a perfect human. It is things that really bother people that they really want to improve, and how we can help them do that.
Mm-hmm.
And the reason why I love this procedure so much is because of the confidence that we give patients when they see their overall result. And it's something that maybe they've never worn a bathing suit on the beach because they don't feel comfortable with their butt or their legs out. And then to, have them show us pictures on vacation in their bikini on the beach and how happy they are with it. It's interesting that the internet kind of decides that improving specific things on your body is vain and abnormal when other things are totally normal and perfect. So I think it's good to kind of talk about. In terms, I think we've gotten kind of the dimpling and the procedures for the dimpling under wraps here. But in terms of the rippled, I know we kind of touched on it, and it's a little bit harder to manage and a little bit tougher to keep results in place. For that rippling, do you feel like M-tone or the Radiesse is the better move? Or is
ideally the combination is better. And then if the combination, because of monetary reasons, is not something that's feasible, it comes down to, do you want something that has absolutely no downtime, no bruising, no swelling, actually leaves you looking better right after the visit?
And it's all natural.
Yep. It's all, no external products being injected. Then you'd pick M-tone, understanding that you'll have to come frequently for visits, but people are really happy with it, and people do come frequently to our office for it. Yeah. People have loved it and have been doing it for years.
Like a hot stone massage meets a lymphatic drainage massage. Like it's not.
I mean, I've never had a hot stone massage. I would say an intense hot stone massage.
Really
let's be, really hot. Yeah. I mean, again, patients love it and keep coming back for it, but the couple of times I've like tested it out on my own like abdomen or something, I'm like, whoa, that is hot.
Yeah.
Yeah. But then for some reason, a lot of our patients are like, it's fine. I don't know.
Well, they do say men have a lower pain tolerance than women.
Maybe that. Yep. And I've never had a hot stone massage, so I don't know. But that sounds miserable.
Report back when you do.
Yeah. And then the Radiesse would be for somebody who doesn't want to keep coming back in, is okay with the downtime. Maybe it's the winter or something like that. If they had to pick one or the other, and it does cost more, so they'd be willing to put up with that as well. Even if you split the cost of M-tone overall that time, it's still less expensive than Radiesse, just because Radiesse is an expensive material. It's a filler.
Yeah, absolutely. Yeah. And it's a lot bigger than a cheek.
Yeah. You're not like filling a chin or a cheek here. It's, it may be the entire back of somebody's thighs or back and sides and butt. It's a lot of injections. It's a lot of bruising. It's a lot of swelling. Mm-hmm.
And do you feel like diet and exercise can help to eliminate cellulite?
No. I mean, so that second type, the rippling type of cellulite, when you have more body fat, the fat you'll see pushing out a little bit more. So people will say, if their body fat percentage goes down, some people will actually improve that type of cellulite. It doesn't go away though or anything, because that's not really the root cause of it. And it's not really anything you're eating or doing, and you can't exercise cellulite away really, except for maybe a little bit of improvement by decreasing your body fat percentage.
Right. Interesting. And then I see all over creams, cellulite reducing creams. They're kind of all over the place, and they pop up every now and then they kind of go away, and then a new one comes out and people swear by it.
with all the good targeting they do now on social media, you probably see a lot more of those.
Yeah.
And I see all the baldness things.
Yeah.
Yeah.
I'm on Cellulite talk, I guess. What are in these creams? Are they?
They vary, but a lot of them contain like caffeine.
Yeah.
Some of them contain like pepper extracts. So they're temporarily irritating your skin, which makes your skin swollen, so you don't see imperfections under it. That's basically all it is.
Yeah. So no like long-term effects.
No, zero. Yeah. Zero chance of improving your cellulite with a cream. And if it is really going to be effective, it needs to be pretty damn irritating.
Yeah.
Yeah. Cause a lot of swelling so you don't see the cellulite temporarily.
Yeah.
Maybe just a few hours, honestly.
I've definitely tried them. Yep. And no, they do not work.
Yep.
Not even in the short term. I don't know. I don't know why they're so buzzy and why it won't just go away, because it seems like they keep popping up. But
yeah, I had a friend try one.
It just doesn't work.
She kind of got fooled by the ad, and it was like these neon attractive bottles, and they looked very harmless, and her skin was like, she said it felt like she was being burned alive. But her skin was smooth for a few hours. Yeah.
All right. Okay. So
yep.
Not no, but not yep. Yes, for yep. sure. Anything else you want to talk about regarding cellulite?
No, I think we covered it, and I've got patients soon. So,
so let's wrap it up. Catch. Okay, so switching gears, our trending TikTok or social media procedure of the week would be something we saw as an Allure article, actually, and it was called the labial puff procedure. Mm-hmm. Have you heard about it? What does it do?
Yeah, we've actually used that term even in our office, I think, for more than a decade. Probably the first time I heard about it was when I did it with one of my professors when I was a resident at Mount Sinai in the cosmetic clinic. And that was the first I heard about it. So, that was probably like 17 years ago or something. So it's nothing new. Mm-hmm.
Maybe the buzzy title of it is new.
Yeah, maybe.
I'm not sure. A labial puff.
Yeah, I don't think we call it that to patients when we do it. It's not something we do like every day. We're talking about, handful here and there per year, but definitely increasing. We've done a lot more this year. Mm-hmm. The procedure is basically filler in the labia majora. So as we age, we lose volume everywhere, and it causes some of the signs of aging. So like on your cheeks, you'll lose a little bit of the fat there and the muscle and the bone, and things start to sag down. Mm-hmm. That's one of the big causes of aging. And combine that with like collagen loss and elastin loss, which ruins the structural integrity of your skin. So you start to get aging on the face. The labia, the vulva is really no different. Obviously, for the great majority of people, less sun exposure there. So collagen and elastin loss, not as severe. Some of that just happens with age and stress and unhealthy lifestyle and things like that. And some of it just happens naturally, but that's not the major issue. The major issue is, so the labia majora, which is the part that's on the outside, versus the labia minora, which is on the inside. The labia majora loses a little bit of the fat under it, and we see the little bit of crinkling on the skin there. It looks deflated a little bit. Mm-hmm. And the only solution when you lose volume is to fill the volume, mm-hmm. one way or another. Same thing as we do for the lips and the face and the butt and all the other areas. In this area, we're injecting fillers to smooth it out again. So to add the volume back that's been lost with time. It's one of the areas that actually shows, I think, age relatively early. Mm-hmm. And that's in the labia majora. The inner part, you don't really see that. What you actually see is from loss of collagen and elastin, the labia minora can actually hang a little bit lower, so become elongated. But in the labia majora, it's really that loss of volume. And you can use any filler. I think the majority of the time we use either Sculptra, mm-hmm. which is polyallactic acid. That's a powder we inject, and slowly you build volume over time. I like that one because it lasts a long time. The patients sometimes have results that last 2.5 years. We also do Juvederm Voluma, a hyaluronic acid one. You can use really any of the fillers. And the one thing to kind of be aware of in that area, it's not like the lips on your face, on your mouth, where one syringe does a lot. So you are going to need a few syringes, so it can get a little bit more pricey. That's one of the other reasons I like Sculptra in that area, because it lasts a long time. So you're getting your money's worth.
Yeah.
And it's another one of those things that I feel like, again, just getting back to that sort of body positivity arguments, again, you'll hear it is weird. It's always like the female specific conditions. I feel like people get sort of hyper sensitive about them, and will say nobody needs to treat that. It's a normal part of aging. 1000%. It's a normal part of aging, and nobody needs to treat it. It would be hard to make a medical argument for why that should be done for medical reasons. It's a cosmetic thing. People are doing it for themselves. Maybe they're doing it for their partner. Why it's getting a little bit more buzz to it is the labia majora. A lot of people have done things like laser hair removal and things like that, or regularly get wax there more than they used to. So it's more visible than it used to be.
Yeah.
That's probably one of the main reasons. And sort of, the adult movie industry and stuff like that, and exposure to that creates societal norms around that as well. So whatever the cause is, if someone wants to do that, there is an available treatment for that. It's safe. It's a vascular area, so we always do it with a cannula as opposed to needles. And I suggest if anybody's having it done, they don't have it injected with a needle, just because it decreases the risk of accidentally injecting the filler into a blood vessel. Do it with someone who's experienced and does a lot of injections of fillers. But yeah, it's a safe and easy thing. I think I saw the Allure article, and then all of a sudden everybody started posting about it again, because it's interesting. Anything that I feel like has to do with the genitals or this or that, everybody's like, ooh, that's going to be a hot topic. Let me post about that. So you'll hear people talking about that. So I think that's why we saw it trending.
Yeah. Plus the nice little buzzy name.
Yeah, it's got a name, Labial Puff. Yeah.
It's really anything that they want to kind of rebrand an old treatment or procedure on and give it a new name, kind of tends to pop off. And it isn't.
Right, I feel like 2 years ago with the Botox and the scrotal skin, everybody was talking about Scrotox. It's now nobody talks about that anymore. Yeah. It's social media for you. Things just
come in waves.
Yep.
All right. Do you know like how many? Is it patient to patient, or like how many syringes?
I think we average anywhere. So if we're doing like either of those two fillers I mentioned, like the Sculptra or the Juvederm Voluma, it's probably somewhere around like 2 to 4, something in that range. Yeah. I think one would be kind of pointless almost.
Yeah. All right. And I think that leads us to our last topic of the week, which is this week's product of the week. I'm ready for you to roast me on it.
Oh no! But
I enjoy. I've fallen into a deep, dark hole on eye creams. I have tried caffeine eye creams. I have tried growth factor and peptide eye creams. I've tried everything. One that I have tried and really, really liked is the K-Ox by Isden.
Our patients like that too.
Yeah. I have no idea why I like it. I obviously don't suffer from much under eye issue. But that one, I like the way that it goes on and the way that it dries, and how concealer lays on top of it. But what do you think about eye creams? Is there one type that works best? Is it the one with the caffeine in it? Is it the one with growth factors in it? Or are they all kind of made the same? And how do they differ, honestly, from just your regular facial moisturizer that's also being put on your under eyes?
Yeah, probably not much. Yeah. And if you love your facial moisturizer and it's doing what you want in the under eye area, and you try an under eye area and it's not really looking like it's any better than your moisturizer, then you probably could skip the under eye cream and just stick with your facial moisturizer everywhere. You know, they'll always be filled with things like you said, the caffeine or peptides is a big buzzword, where peptides supposedly can penetrate into your skin and do things like getting you to generate collagen and elastin. All of that without any sort of enough definitive proof scientifically to actually like prove that they do that. You know, we're not seeing major double-blind placebo-controlled studies. We're not seeing any FDA approval for any of these things. So some of it's a trial and error. Maybe your under eye cream is just suited better for the thin skin there, and you like it, and you think it is doing something compared to your moisturizer. Put it on. I don't think it's probably making any sort of long-term changes. But if you're using it every day on the days that you're using it, it may be improving the fine lines and wrinkles. Some of them have like titanium, which masks. It's like a block, so it doesn't allow the darkness to show through, kind of like makeup. So that's another benefit. It can help with like the darkness in the hollows under the eyes. You know, but then they all have other ingredients. You know, the one ingredient that does have FDA clearance for treating fine lines and wrinkles and improving discoloration and things like that is retinoids. So retinol over the counter, tretinoin as a prescription. It's tough to use it. There are some retinoids, retinol products that are under eye creams. Like there's one, let me just look it up. Hold on. There's one sec. So the La Roche-Posay Redermic R Eyes Retinol Eye Cream. That's
a mouthful.
Yeah, it's a lot. That's one that I had tried and could tolerate. I don't use it regularly. I think I tried it like a while ago and gave up after a few days. But using a retinoid under your eyes could build collagen and be anti-aging. I use a prescription one and just put it over my moisturizer for anti-aging, and nothing's going to be better than that in terms of a cream. Yeah. But a lot of people, you know, the problem with retinoids is they're irritating for a lot of people, and eventually you'll get used to it. Most people especially on like the thicker, like forehead, nose areas like that. But in the under eye people, some people just never get used to it. So I'm not suggesting everybody jumps to using retinoids there. Just test it out, see if your skin can handle it.
I would say like the meatier parts of the face in terms of retinol first, and then as your skin gets used to it, you can kind of scooch it up to the under eye area, and your face should be okay with that. But always, if you have an under eye cream, you may want to put it on top just so that you don't have any like discomfort in terms of redness and dryness in the under eye area. But I mean, I guess overall, it works for some things. I mean, sometimes there are things in people that just need intervention if they really want to improve that area. No under eye is going to fix some things, but it could. Yeah. What I'm hearing is it could help.
Yeah. No, I mean, and patients really like some of them, and everybody has their favorites. And I think that, our skin on different parts of our face is different. Right. Like your under eye is very different than the skin on your nose, which is right there next to it. You know, just different oil gland, different makeup. And, you know, if you find a particular cream that's best suited for that area and it's not too much of a hassle, then go for it. Yeah, use an eye cream and then use a moisturizer on the rest of it. And, you know, you can figure it out. Maybe like a particular neck cream or this, you know, everybody's got their things. And a lot of it's trial and error. So it'd be ridiculous for me to be like, these are the 4 steps that everyone must do. No, that's just, you know, that's not true. Everybody has to kind of do trial and error and work with your dermatologist or esthetician or figure it out on your own and just, trial and error.
Eye creams.
Yeah.
Figure it out.
Yeah.
Yeah, I agree. I think it's just like makeup. It's just like anything else. It's like your face wash and your moisturizer.
Mm-hmm.
It's no one is going to be great for everyone. And if it is something you want to try, and it's really not an integral part of your nighttime routine, right? Like at the basis of what you should be doing every morning and every night, an eye cream is an add-on. It's a nice add-on if you want to, but I know what you kind of tell our patients in terms of like, bare minimum, what you want to do for your skincare routine. An eye cream is something you can work into when you kind of get bored with the three products
they do get pricey, some of them, some of the like
$250.
Yeah.
And that sucks if you try.
And if it's doing nothing for you, then skip it and just use whatever you're using on the rest of your face.
Yeah. Case closed.
Cool.
We did it.
Let's go see patients.
Let's do it.
All right.
See you next week.
Bye.
Bye.
Thank you so much for tuning in today. If you enjoyed this episode, please make sure to subscribe to Dr. A Explains It All on your favorite podcast platform. By subscribing, you'll never miss an episode, and you'll be the first to hear about our latest discussions on skincare, cosmetic procedures, and more. And if you found this content helpful, we'd love for you to leave a rating or review. It really helps us reach more listeners like you. To learn more about our podcast or to send us questions you would like answered on here, please visit our website at drapodcast.com. That's drapodcast.com. To see us as a patient at our New York clinic, visit us at dermatologyandlasergroup.com.